A very refreshing good afternoon to all of you present over here. So, in today's CellTalk webinar, we have with us Soumya Datta Basak, who will be presenting on the topic Effects of Social Participation Patterns and Living Arrangement on Mental Health of Chinese Older Adults. Soumya joins Renix Life Sciences as a junior bioinformatician. Her primary responsibility involves identifying and implementing bioinformatic pipelines tailored to project specifications. She is currently working in a project focused on neoantigen peptides, employing molecular docking techniques to investigate their binding interactions with specific receptor proteins for potential applications in cancer immunotherapy. She holds a master's degree in bioinformatics from Chandigarh University, and before that, she earned a BSc in genetics from Guru Nanak Institute of Pharmaceutical Science and Technology. Soumya has gained valuable experience through dissertation training and internships at institutions such as National Institute of Animal Biotechnology, Hyderabad, and Bionome. Her goal is to continually acquire new skills and apply them to impactful projects within the realm of bioinformatics. So, without wasting any more time, I would like to share the floor with Soumya. Over to you, Soumya.
Thank you for your nice introduction. So I'm going to start the presentation now. So my name is Shumadatta Boshak and my topic of presentation is effects of social participation patterns and living arrangement of mental health of Chinese older adults. So the journal has been selected from Frontiers in Public Health, which has an impact factor of 5.2 and the year of publication of 2022. The research has impact on mental health and aging. So let's get started with the introduction. Health is the most important thing in our lives. According to the World Health Organization, health is defined as a state of complete physical, mental, and social well being, and not merely an absence of disease and frailty. So, it is quite evident that mental health is also a crucial component in overall well being. And as older individual ages, they tend to develop different kind of negative emotions due to physical frailty and cognitive decline. And as the surrounding is evolving and changing, the aged people they develop these negative emotions or negative feelings such as depression, anxiety, and loneliness, which results in poor coping, and it also increases the risk of chronic diseases and mortality. While on the other hand, positive emotions, for example, optimism, joyfulness, and gratefulness, it impacts the health of older individual in a better way. For example, it slower the physical degeneration, it helps in the better physical functioning, and it also increases the longevity. So good mental health not only directly impacts to the overall well-being and the life satisfaction of one mental health, it also indirectly impacts on the physical health on the later part of the life. That's why it's very critical to understand the association between the social participation and how it affects the physical and mental health of older individuals. Next, we have social participation. So, social participation is defined as an individual's activity in real life, and it plays an important role in reinforcing social relationship, social support, social integration, resulting in better health and related outcomes. So, social participation is a very important component for active aging, and it has been used in major studies that is related to aging. So, social participation helps the older individual to maintain social relationship after retirement, and to avoid social isolation that might impact one's mental health. So, social participation lowers the risk of depression, cognitive impairment, and as well as it also improves the aspects of self rated health, well being, life satisfaction, and quality of life. In addition to that, it also helps to control the negative emotions or negative thought that might comes to an older older citizen or senior citizen. And the social participation and the overall health differs from person to person. For example, household activity, physical activity, gender, marital status, etc. Next, we have the general background, which talks about this theory known as cognitive motivational relative theory of emotion. And this theory holds that positive emotions and negative emotions are always caused by external factors. And as an external factors, family plays an impactful factor in an older people life. So there has been study that has conducted among the Vietnamese and Thai older people, in which it has been seen that senior citizens who have been living with their family, they receive help, they receive companionship, and due to this they have less negative thoughts and greater number of positive thoughts, which impact their mental health in a good way. While on the other hand, senior citizens who have been living alone without their family, they do not receive any help and companionship, and that's why it has been seen that they tend to have more negative emotions about themselves. Thus, it is extremely crucial to investigate how these external factors affects the social participation of the senior citizens, thus affecting, which also affects their mental health. Next, we have the present challenges. So most of the studies that has been conducted, it's basically focused on all types of social participation collectively without any distinction between them. And there are several kind of correlated interrelationships between measures of social participation and activities that are not well understood still now. Previous studies often use depression, anxiety as sole indicators of mental health, while in reality there is diversity of emotions that is experienced by older adults, and these previous studies have completely neglected them. So, thus, in this study, the researchers have taken a national survey and they are conducting an investigation how social participation can affect the mental health by making a distinction between them and how they are related to each other. And then we have the objective of the research. So, the main objective of this research is to explore how different patterns of social participation among older people relate to living arrangement and mental health status of older adults, and investigate the impact of individual characteristics such as uh, socio-demographical characteristics such as age, gender, education, and these patterns. And for doing this analysis, the latent class analysis technique have been used. This is used to identify and group latent types of social participation among older adults in China using the national survey data. Next, we have the methodology. So the first step of the research is collection of the data. So the data has been collected from this Chinese longitudinal healthy longevity survey, which is a paired up program between Duke University of USA and a university in China. So the baseline year has been selected, which is 2014. So the baseline year data includes several kind of social participation patterns, living arrangement, external factors, etc. And the follow-up year, follow-up year, which is 2018, has been selected, which is after 4 years. So we have a total sample of 7192 individuals in this particular survey, among which 1929 and 32 individuals data has been eliminated due to missing data, and there were also people who were younger than 80, and also 3294 died before 2018. So by eliminating all these factors, we have this total 2535 respondents for further analysis. Next, we have variables and operational definitions. So, 8 baseline questions were asked to measure the social participations through activities. And these questions include household work, field work, gardening, reading books, pet parents, playing cards, watching TV, and social activity. In addition to that, the questions related to living arrangement were also being asked, which is whether they are living with the family or whether they are living alone. And each answers have been dichotomized. For example, if the answer is yes, it is indicated as 1, and if the answer is no, it is indicated as 0. Next, we have positive and negative emotions. So, positive and negative emotions are the proxy variables that have been used in this analysis. So, a questionnaire was prepared that included questions of positive emotions and negative emotions. The questions of positive emotions included, these questions were basically asked, which includes self reported quality of life, look on the bright side of the things, and do you feel happy as you were when you were young? And the questions from the negative emotion questionnaire included, like, are you nervous and scared? Do you feel lonely? And do you think that the older you become, the less useful you were? Each entry has been rated from 1 to 5. 1 means very good and always, and 5 means very good and never, depending on the question. And the sum for each entries has been summed up, and the mean value was generated. It was calculated. So the individual values that we got from the older citizen, we are checking whether the value is less than mean value or not. If the value is less than the mean value, we can indicate that that particular individual has high positive emotions and lower negative emotions, which is indicated as 1. And the value, and if the value is greater than or equal to the mean value that has been calculated earlier, this means that those individuals have lower positive emotions and higher negative emotions, which is indicated as 0. Next, we have this socio-demographical characteristics questions, which again it has dichotomous coding. So potentially relevant covariates at baseline were obtained for socio-demographic characteristics, health, and economic status. For example, for this age, we are differentiating, like, if the person age is from 60 to 84, then we are indicating at 0. And if the age is more than 85, then it is indicating as 1. Similarly, for the gender, if there's a male, if that particular patient individual is male, then it is indicated as 1, and if it's female, it is indicated as 0. So similarly, 9 socio-demographical characteristics were evaluated by this dichotomous coding, and it was used in further analysis, which we will be discussing later. And the last part of the analysis is the LCA data analysis. So the primary goal of the LCA is to find the smaller and the fewest number of unobserved classes from account for observed relationship among the symptoms. In order to access the best fit model, several metrics were used. For example, a Kyle information criterion, Bayesian information criterion, and other also matrices were used to evaluate which model will fit the data, and it will give best possible result without overfitting it. And then frequencies, proportions, and chi-quest tests were implemented to summarize sample characteristics and differences among social participation classes. Binary logistic models were also used to test the relationships between the social participation classes, living arrangement, and positive and negative emotions. And thus, it is extremely crucial to evaluate how the external factors are affecting the mental health, and how this living arrangement, mental health, and social participationship is interrelated with each other. Then we have the results. Patterns of social participation, a 3-class model. So 5 little class model were created in the study by combining the matrices that we discussed earlier in the slide. So here we can see, as the number of classes is increasing, there's a decrease of this ABIC number, which is a matrix. And usually what it means that if the ABIC number is low, it is decreasing, that means it is a better fit model. So in this graph, we can see the same thing. As the number of classes are increasing, the ABIC value is decreasing. But to select the best fit model, we are noticing the biggest jump point from the data, or which is known as the inflection point. So we can clearly see that when we are jumping from 2 classes to 3 classes, we here can see the biggest jump. That means when we uh, in the when we go from two classes, we can see a better improvement compared to these classes. So that is why this class 3 model was selected. And then we have the three class model, which has been explained here. So the three class model is distinguished into three parts, for example, like class 1, class 2, and class 3. Class 1 indicates the moderate activity, class 2 indicates the high activity, and class 3 indicates the low activity. So class 3, which is the low activity, 17.5%, it showed low engagement in social activities. As we can clearly see in the graph, it is the lowest among all when we are comparing to the high class and the moderate activity. And then classes 1, which is 46.3, and class 2, 36.3, were labeled as moderately activity and high activity respectively, with distinct preferences, especially for home-based activities for class 1. Here in this graph, we can clearly see that the class 1, which is the moderate activity, they have the high tendency of choosing the household work rather than all the 8 category that has been here. And next, we have the participant characteristics. So here we can see the age group. In this analysis, we can clearly see that most of the individuals, more than 70%, which is 74% of elderly population, belong to this young elder group, which is age 60 to age 85, and remaining 26% belong to the age greater than 85. And the gender is almost equally distributed, like 51% of them are male and the rest are female. And then the residents, for example, here we can see that 43% of them lives in a city, while 56.5%, which is the majority of them, lives in rural or countryside area. And in the case of education, we can see 54.1% is non-illiterate, and only 45.9% is illiterate. And then when we see a occupation level, we can see a huge difference between this high level and low level. So most of the elderly people, which is 95.3%, belong to this low level occupation group, and only 4.7% belong to this high level group. And similarly, married were 55.5% and other were non-married. And here we can see a significant impact. For example, we can see here that most of the elderly people in China was living with family. For example, we can see a huge majority of them, like 78.3% was living with family, and only 21.7% was living alone. And the self-rated health was distinguished into very good and very fair, poor and very poor. So 50.3 were rated themselves as very good or good, their health basically, and remaining are fairly poor or very poor. And next we have this ADL limitation. So ADL limitations is nothing. So it is basically the capability of the older individual, whether they can do their daily activities without any help or limitations. So we can see most of them, which is 93.5%, did all the basic daily activities without any help on, and only 6.5% needed help for doing basic daily activities. And also we can see positive emotions and negative emotions. This is very important. So we can see uh, in this case, for positive emotions case, a majority, which is 58.3%, belong to the lower positive emotions category. Like 58% of them had lower positive thoughts, while we can see in lower emotions case, majority, like 55.9%, belong to the lower emotion field. This means this number of person had negative emotion. Next, we are going to discuss the factors that is affecting the patterns of social participation. So I'm going to discuss all the details of this table in this particular slide. So there are four factors that is affecting the patterns of social participation. So the first factor is age and activity. The older people whose age was 85 plus were less likely to be in the moderate or the high class activity compared to the low class activity. And we can clearly see here for 80 for age greater than age 85, the odd ratio value is lesser than 1, which is 0.39 and 0.38, which is a negative association between them. Next, we have marital status and EDL limitations. So married couples or married people, they were more likely to involve in moderate and high class activity likelihood. For example, here it is 1.71 and 2.37, which is greater than 1, and it is indicating positive association between them. And then also we have ADL limitations. They also had moderate and high class activity likelihood. Here also we can see this more than 1, and it's around 4.75 and 4.93, the odd ratio value. And the third factor is gender and living arrangement. So it has been observed that male were less likely to be in moderate or high class activity likelihood. And here we can see it is 0.47 and 0.88, which is less than 1, which is indicating a negative association between them. And living with family also, and the older people who were living with family, they were also less likely involved with moderate and high class activity. For example, we can see living with family, it is only the odd ratio value is only 0.84 and 0.67, which is again less than 1, which is indicating negative association between them. And then lastly, we have self-rated health and education. So the older people who have rated their health as good or fair, they have been linked to high activity likelihood. For example, self-rated health, here we can see 1.20 and 1.91, which is greater than 1, and it indicates a positive association. And then we have the older people who had higher education, they are also linked to high activity. And here we can clearly see that the education for the high class activity part, the odd ratio value is 2.70, which is again greater than 1, which is indicating a positive association between them. And these are the four factors that were affecting the patterns of social participation. And then we have relationship between the living arrangement, patterns of social participation, and mental health. So the first point is association with emotions. Baseline social participation linked to positive and negative emotions. So it has been clearly seen that social participation, it is very crucial for controlling the positive and negative emotions. As the social participation increases, the positive emotions increases and the negative emotion decreases. And second, we have emotional trend. So the elderly people who have been involved in the high activity category, they have been associated with high positive emotions and lower negative emotions, like what I've said in the first point. And this point has already been proven by the regression analysis, which has been done in the earlier slide, that higher activity correlates with higher positive emotions and lower negative emotions. And then the fourth and the most important point is one of the most important point is living arrangement impact. As we can see that living with family has a great impact on elderly people life, and the older people who have been living with their family, they have less negative emotions significantly. And next, we come to the discussion. So we have identified three patterns of social participation, which we already discussed, which is low activity, moderate activity, and high activity. So the older people who were in the high activity group exhibited significantly lower emotions and higher positive emotions compared to other groups, because they were participating in different kinds of social work, or they were involving in more interaction with their family, and that's why they have less negative emotions and higher positive emotions. And then we have association between social participation and mental health, with aligns with the previous research highlighting the importance of active engagement. So we can clearly see that the active engagement of the older patients to the outside world, like social participation, participating in various kind of programs, household work, exercising, these kind of things affects the mental health and also the physical health of the older patients. And then we also have the socio-demographical characteristics that is affecting the mental health and the social participation patterns, like age, gender, education, marital status, and living arrangements significantly influence social participation patterns. For example, marital people had high number of social participation, and as we also seen that the elderly people who had high education, they had involved in high class activity. That's why they tend to have fewer negative thoughts and higher positive thoughts. So here also, older adults with higher education, good health, and disability free status, which is areal limitations, were more likely to engage in high activity social participation. And the elderly people with poor health and areal limitations, they have tendency to acquire more negative thoughts because they have limited activities. Thus, we can conclude that diverse social participation patterns influenced by demographic and health factors significantly impact the mental health of the older patient. Thus, tailored interventions are needed in promoting an active aging and social engagement so that it can improve this emotional well-being and it can reduce the negative emotions in older adults. And lastly, we have the impact of research. It provides actionable insight for families, society, and government to identify mental health risk and tailor interventions for older people, promoting active aging and social integration. And secondly, it also enhances the understanding of how these social participation patterns and living arrangement affect the mental health of the older people, contributing to the more effective healthy policies and support system. For example, we have already discussed in the family section, the older people who are living with family has less negative thoughts. And that was all from my side. Thank you. You can, if you have any further question, you can find me at shomodatta@twenx.org.
Thank you, Soumya. That was one very interesting talk. So I would now like to open the floor for the audience for any doubts or questions. So Nupur asked, how does the economic condition after mental affect mental health for aged people?
Okay, so this has been distinguished between high income people and the low income people. The high income people, they have they might have less thoughts about the economic status. That's why they can focus more on the social participation, like engaging with their friends or any other, like gardening, exercising. That's why they might have less negative thoughts and more positive thoughts rather than the people who are on the low income side.
Thank you, Soumya, for your answer. I do not see any more questions. We can wait for a minute to see if there are any further questions. I think we are done with the question and answers query. So thank you, Soumya. That's all. Thank you, everyone. So the next presenter will be Arya, who will be presenting on the 29th of May 2024. She will be presenting on the topic of association between healthy eating and depression symptoms among Chinese older adults, a cross-sectional study based on the Chinese Longitudinal Health Longevity Survey. So please be available on the next presentation date. Thank you for being here today. Thank you.